Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Mudupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. Today on the program, we are looking at a natural condition experienced by women in their mid-40s and late 60s. A consultant is on standby, a consultant obstetrician and gynecologist is on standby to tell us how to navigate this path and how to manage this condition when it starts or when it's experienced by this category of women. Stay tuned, the conversation begins after this break. Health on Lagos Television. Joining us via Zoom this evening is Dr. Chukwuemeka Odeigah, a consultant obstetrician and gynecologist with the LATROS Specialist Hospital, and he is going to tell us what exactly is menopause. Good evening, Dr. Odeigah, and thanks for joining us.
Good evening. Thank you for having me.
All right. Looking at women, the reproductive age of women, many women experience some natural conditions they can't just explain. One of them is menopause. What exactly is this condition in women?
Well, as you rightly said, menopause is a natural condition. It refers actually to cessation of the woman's menstruation for a period of at least 12 months. You have to have a period of at least 12 months without menses, and it's due to natural causes, actually due to diminishing function of the ovaries. Okay, part of the function of the ovaries are production of eggs, which contribute to the woman getting pregnant. Okay, and apart from those eggs, they also produce hormones, especially estrogen and progesterone and other kinds of hormones. So when you now have a situation where ovulation is no more taking place, and those hormones which are also go along with the process of ovulation are also diminishing, that now leads to this condition called menopause.
And what are the age groups that experience this condition? Have we seen women as early as age 30, mid-30s experience this condition too?
Yes, the physiologically, or at least from statistics, we have that generally occurs in women between the age of 45 to 55. The average age in Nigeria is between 50 and 51. But when this is happening before the age of 40, we call it premature menopause, okay, or premature ovarian failure. So it's actually possible But when it's happening before the age of 40, it's not a normal phenomenon.
So if it's not a normal phenomenon, can it be induced by medications, some medical treatments and all that?
Yes, certain times, certain forms of treatments which will be offered for other conditions may actually cause a period of menopause, but that is temporarily. Okay. For instance, some of the medications we use to treat something called endometriosis, okay, involve the use of hormonal drugs, okay, especially what I refer to as GnRH agonists. And for the period where the effect of these drugs are actually lasting for, they may actually cause a condition that is very similar to menopause, okay? But usually, by the time the effects of the drugs wear off, the woman would have a normal menses, and some of the symptoms she may experience during that period, some of those menopausal symptoms might actually pass away. Okay? Even, for instance, in IVF, okay, because I also do IVF, I also practice IVF, certain protocols we use for stimulation. For instance, especially what we call the agonist protocol, the long agonist protocol. We also make use of some of these drugs. And while the patient is actually on these drugs, she may actually be complaining of menopausal symptoms, things like hot flushes, bone pain, vaginal dryness, which are usually attributable to the drug. Okay, but as I emphasize, they are usually temporary things. And where the difference is that unlike menopause, where we'd have to stay for a complete 12 months before we can actually say this woman is menopausal. Okay, this is actually a temporary thing.
All right, so let us know the symptoms apart from stoppage of the monthly menstrual cycle in women. What are the other symptoms? Can a woman just assume she's menopausal, she's experiencing menopause?
Well, the cessation of menses is a very, very critical symptom. Okay, why I'm saying this is that before the menopause, actually what is referred to as the perimenopause or the climacteric phase, the woman may actually be experiencing some of the symptoms of menopause. Okay, even though her period has not stopped, or her period at that stage is irregular. So it's not simply by having symptoms alone, but that issue of cessation of periods is very, very critical. Okay. Also, to be emphasized is that just like when the young lady was just attaining menarche, that's started menstruating for the very first time, usually the first couple of periods are not regular. She may have one this month, skip, and when it's also getting towards the end, a similar thing happens as well. So what I'm saying is that we will not diagnose menopause based purely on symptoms, okay? But that issue of cessation of periods is very, very critical. Now, some of the menopausal symptoms, we have some that are short term, some that are medium term, and some that may happen in the long term. Some of the short-term symptoms include psychological issues. The woman could be depressed, she could be experiencing mood swings and things like that. She could be having irregular periods, just as I mentioned earlier. She could be having what I refer to as vasomotor symptoms, okay? So things like hot flushes, night sweats, palpitations, and things like that. She could be experiencing things in the short term, things like that are related either to the genital urinary system, okay, things like that. I've had a patient once that was complaining of continuously complaining of pain during urination, and they had done different urine cultures, different places, they couldn't find anything, and by the time we just put her on some form of topical hormone replacement therapy, We gave her something called Primarone, conjugated equine estrogen, the cream, to apply on over the genital area. By the time she came back about 2 weeks later, that had gone. So that is also a possible presentation of menopause. There are long-term symptoms which relate to the bone, the brain, and the heart. Okay, so bone, for instance, I mentioned brain pain. Okay, earlier on when I was talking, these patients are now more prone to developing what's called osteoporosis, which can lead to very brittle bones that can easily fracture. So in a situation like that, you hear that mama fell down and she broke her hip, things like that. In terms of brain, possibly features of dementia and things like that, and then heart. Not that menopause causes heart problems, but that before attaining menopause, the risk of heart disease, especially myocardial infarction, that's like heart attacks and things like that, actually less for women compared to men. But actually, by the time they go into menopause, the incidence or the occurrence is about the same, which shows that probably those hormones may have a protective effect against heart diseases. So basically, those are some of the symptoms of menopause.
Okay, thank you so much for also looking at because you also touched some health implications. All right, let us look at the management of this condition. Is it treatable? Can it be managed because it's a natural condition?
Well, in terms of management, being a natural condition, we can't actually cure it. Okay, we cannot make the lady who has stopped menstruating because she's not ovulating anymore due to natural causes. We can't make her ovulate anymore. Okay, but many of the symptoms which are as a result of depletion of the level of hormones, we can actually manage by replacing some of these hormones. Okay, although it's not, hormone replacement therapy is not without its own risks as well. So we have to carefully evaluate any patient before we say we want to put them on hormone replacement. And then it's also important to emphasize that the symptoms, especially the vasomotor symptoms, usually last for about 4-5 years, the first 4-5 years, and then after that, usually there tends to be naturally an improvement, even without any form of medication. Okay? Also, sometimes these symptoms tend to be less severe among our own women compared to Caucasian women. So a lot of our women may not actually be coming to the doctor to complain about this issue. Also, the symptoms tend to be less in women that have more body mass, because actually the fat cells, the adipocytes on the skin, actually produce a type of estrogen, which is a little bit different from the estrogen being produced by the ovaries, but still have some effect in reducing the symptoms. So, hormone replacement therapy we can offer, okay, to women that are complaining principally of vasomotor symptoms, okay, these hot flushes, night sweats, and things like that. We can actually offer that, okay, and it's essentially in the form of replacement of estrogen, okay, with different forms or delivery systems, okay. What is also important to note is that hormone replacement therapy, we want, because of certain risks that may be associated with them, risks including the risk of strokes, the risk of heart attacks, there's may be an associated risk of breast cancer, okay, associated with long-term use of all these things. So before we start, we need to properly screen the woman for any of these underlying conditions to make sure that these things are not there before we start any treatment, okay, for them. It's also important for us to start with as low a dose as possible that can actually achieve a control of symptoms, okay, and to also use this medication for as short a period of time, okay. There was a big study somewhere where they talked about the risk of breast cancer and things like that. They talked about that was the Women Health Initiative, and from that they found that the optimal time to actually prescribe HRT for was between 3 to 4 years, because by about 5.2 years, the risk of breast cancer was now significant. Okay, so using it for as short a period of time, okay, and the delivery system, we should also use it when we are using it. If it, as I emphasize, actually for vasomotor symptoms, we are not using it to either for primary or secondary prevention of heart problems. Okay, so these are some of the precautions when we are using HRT, principally estrogen. Also, for a woman that has a uterus in place, okay, giving unopposed estrogen, we are just giving estrogen to the woman without any form of hormones to oppress and to balance it out, increasing the risk of her developing something called endometrial cancer. That is the cancer that has to do with the wound. Okay, so also to prevent this, we will also be required to give her a form of progesterone. That's another type of hormone. Okay, after she has been on this estrogen for about maybe 10-12 days in a month. Okay, so these are some of the precautions too associated with HRT.
That has been Dr. Chukwuemeka Odeigah, consultant obstetrician and gynecologist, as well as medical director with LATROS Specialist Hospital, on how to live with menopause. We bring you the concluding part next week. Please plan to join us. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. Remember, life does not end with menopause. It is another adventure, a natural phenomenon every woman must encounter. Seek medical help early enough if you're experiencing any of the conditions listed by Dr. Odeigah. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, if you have topics you'd like us to treat, please send SMS to 00358266603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.